Westfield Memorial Hospital provides high-quality health care to residents of Western New York, offering patients the most sophisticated medical advancements while keeping the ease and familiarity of a community hospital. Support for Chautauqua Sunrise has been provided by WRFA 107.9 FM, Jamestown's public radio station, streaming online 24/7 at WRFALP.com. Low power to the people. Meter's Restaurant, a family tradition for over 50 years in downtown Ripley, is a proud supporter of Chautauqua Sunrise. Meter's provides all-day dining, banquet services, and custom catering, specializing in pie.
Funding for Chautauqua Sunrise is provided in part by the County of Chautauqua Industrial Development Agency, with offices in Jamestown and Dunkirk, helping businesses to prosper throughout Chautauqua County. For more information on how the CCIDA can assist your business, visit choosechq.com.
From supporting people with disabilities to enjoy great lives to providing health care services that are available to anyone, the Resource Center has been improving our county for more than 60 years. Learn more about how the Resource Center makes a positive difference in people's lives.
Is getting vaccinated on your to-do list? We can help you check it off because we make getting vaccinated easy. You've got this because we've got you. To learn more, visit yougotthis.usaging.org.
From the Access Chautauqua Studios in Mayville, it's Chautauqua Sunrise. Chautauqua Sunrise is hosted by Doc Hamels and supported by the award-winning volunteers at Access Chautauqua. We are here to share local news, colorful interviews, and events of interest to everyone. Chautauqua Sunrise is broadcast live Saturday mornings each week from 9 to 10 a.m. Send events via email or call us live. Check us out on YouTube and Facebook. And now, from the Access Chautauqua Studios, it's Chautauqua Sunrise.
That's us.
Good morning.
Good morning. I'm Randy Burt, and this is
Dana Corwin.
And we're going to do a guest co-host show today.
2 for 1.
2 for 1. You can't beat that. So we are, Doc is gone again. I don't know. I think he's leaving today. From what I heard, he hates to fly, but he's going to Ripley International Airport. They've chartered a crop duster. 2 seats in the front and 1 in the back. From now, what I hear, the pilot and his wife sit in the front, and they knock Doc out because he hates to fly, and they put him in the back until he gets to his destination. So, sorry, Doc. I think they copied that from a TV show, maybe the A-Team.
Could have been.
I don't know why people don't like to fly. But so we're going to be hosting the show together today, and this is, I think, a first for Chautauqua Sunrise. So since last time I was on, I tried doing my 60th trip in an airplane. Well, it was January 21st, a total blizzard. Got out to Buffalo. My son and I were going to the Price is Right in California. We had the tickets, the car, everything paid for except for the weather. When we got to the airport, it was beautiful. But by the time the plane got there and we got ready to leave, blizzard came in. And our pilot decides he wants to be the first one to be de-iced when they get the airport reopened. So he backs out about a little over a plane length, and we sit there for 2 hours. And finally, they can only keep you on a plane for 3 hours. So, okay, he's going to start the engines. We're going to drive back into the gate. Engines are froze solid. So we sat there until somebody came, and somehow they de-iced them. He drove us into the gate. We all had to get off the plane, take our suitcases, trip over. That day, none of the American Airlines planes were taking off from Buffalo. I'm not sure if the pilot ran out of time because the airport got nicer, or if
The weather.
something happened to the plane when he tried to start it. But I mean, they could de-ice the plane, but so that was my trip to The Price is Right. Pretty depressed, but we'll try again here in the fall. So,
Maybe next time, right?
oh, I hope so.
You got your outfit
I
ready?
mean, they made a custom shirt. They made one. I think they made that one in California, and I wanted a wrap around where I have name tags from when I was there before, and it came back. It looked good, except on the shoulders, it was all sewed weird.
How long ago was it that you were on the show?
I was back there the last week before they shut down because of COVID
Oh, okay,
back in the
okay.
COVID year, and it was like they didn't know what to do. I mean, the show back then held like I think over 300 people,
Yeah.
and the week before I got there, they only had 58 people show up, but they went around CBS and got all the crew people to come in and
be in the
make
audience?
it look full, yeah. But they didn't know what to do because they give away trips to Europe and all over the world, and they'd already felt the COVID more than we had here in New York, and everything was hand sanitizer. You ever try clapping with hand sanitizer
Get a
on
little
your hands?
splatter?
It doesn't work well.
Or stick?
It's like it just
Yeah, sticky.
there's no sound. So I went on a Monday to Tuesday. Wednesday they filmed. I flew home on Wednesday. Thursday they canceled. And I got home and in the airport in New York that night, somebody had COVID that got on an airplane, and I'm like, I mean, mask, what's a mask? Some people had masks on. There was two ladies that sat next to me that were wiping everything down with sanitizer, and it was like, I'm sitting there trying not to laugh, and I think they could tell, and they go, they wanted to go to the seats behind us because it's the emergency escape, you got more leg
Okay,
room.
you got a little more
That's
leg
what they
room.
were saying, but
That's
they wouldn't
good.
let them because of the price, because it costs a lot more to have them. So the stewardess told them, once we get up in the air, there's seats in the back, you can go. So
Kind of spread out through
we got
the
up
time?
there, and they went in the back, and I had the seat to myself all the way back to New York. But the funny thing was, after New York, we went to Buffalo, and then the ride home. I got home and I had an email from The Price is Right. Said, you couldn't make this one show. We're having a special tape it on Sunday. And I'm like,
Oh, so you
I
missed
just got
that
through
spot.
coming. Well, they never had it because they canceled like a month of filming. Then they went to no audience for a while, and they finally moved to a new studio because CBS is getting gutted and redone, and the audience I think is a little smaller, but they're back to a full audience, which is so nice.
It's a great show.
I mean, I watched it since 1972.
I
and
think a lot of us grew up watching that show. Or
it was like I think
who's the current host?
Drew Carey.
We talked about that, Drew Carey. Yeah,
You know,
that's
Drew
right.
Carey was funny because the last time I was there, during commercials, they talked to the audience.
Mm-hmm.
And I'm sitting there half asleep because it was my second show that day. And it's a long day. And, hey, Randall, you're older than the Beatles. And then instead of laughing, he's like doing that. Every joke he cracks. Well, we talked for the whole couple minutes while they were changing sets. I don't remember, besides that, what we talked about. But it was funny. I never got on the show. But
Oh, that would have been great. You could have run down the aisle.
Oh, well, I'd have to walk. You know what? Oh, their aisles, they come downhill and they get them
I was going to
painted.
say they look like they're
They look
sloped.
like they're slippery. I mean, even when I walked in, I'm like, I'm going to fall down. But,
Yikes.
so they have a new studio in Glendale, and I spent a month almost before the trip I was supposed to go on watching the wildfires. They were all around Glendale, but Glendale never got them. So they did cancel a couple days right off the bat on The Price is Right.
Well, it sounds like you have some interesting vacations.
Oh, it was fun.
you know, that's pretty.
We just got back from Florida because Chris he came back on a train, and Justin and I flew, and he came back. Let's go to The Price is Right. So he must have been on the train finding out all the info.
Gotcha.
So he booked it like right after he got home. So
Exciting.
if you guys want to call in today, first I want to say you can watch us live at 1 o'clock on WR. Listen to us on WRFA Radio in Jamestown, 107.9, Tuesdays at 1 p.m. You can email us. You can call in live at Chautauqua Sunrise at gmail.com, or phone number 716-753-5225. So We're going to get the show started and see how we do. We got some interesting topics today that,
We do.
especially when I think you get a little older. I don't know if it's for the younger, but everybody gets older sooner or later.
We're all aging. No matter what age we are, we're all aging, right?
Oh, man. Can't believe, like in the 50s, I was always asking, how old do you have to be to go to the office of the agent? Now I'm like, I think I'm getting too old. It's like, okay, so I have
All are welcome.
announcements. 4-H is going to have a class, certification class. It's going to be held April 14th through 19th. This year, course will be held April 14th through 19th. Classroom sessions will be held at Jamestown Community College Carnahan Center from 9 to 3 p.m. A hands-on learning course will be held April 16th from 4:30 to 7:30 p.m. at Land Pro Equipment in Faulkner. The written test will be held at Westfield Ag and Turf on April 17th at 1 p.m. And then they have a practice driving opportunities will follow until 5 p.m. The final driving evaluation will be on April 19th at Land Pro Equipment in Clymer, New York, and Larry Romance in Sheridan, which times to be determined after the start of the class. This is a class for like 16-year-olds that are going to be working on a farm. As you can see, they're running tractors. All this farming equipment can be dangerous, so they're going to teach them the safety of everything, working with animals, driving tractors and stuff. But pre-registration is required prior to March 31st. Cost for registration is $25 for 4-H youth and $35 for non-4-H youth. Register by going to https://pub.cce.cornell.edu/event. Registrations/main events. Underline in it.
Don't have to read all of that, Randy.
Oh, thank you. Okay.
Makes it a little easier.
That one's easier. I got two more, and then I'm going to get a helper. Next one's an easy winner. First winner, farmers market season. Local food and live music and free pancakes, coffee. Perfect way to start the weekends and get out of the house. And that's today. It's at 9 to 1, so it's going on now. St. Luke's, Undercroft, 410 North Main Street, Jamestown. And guess what? Today, bundle up and join us for the coldest night of the year walk. This heartwarming, family-friendly event supports a great cause, the YWCA Jamestown's Transitions Housing Program. What to expect? Meet and take photos with Elsa and Anna from Frozen. Face paintings for kids at heart. That could be me. I think I had that done once in Erie at a
Face painting?
kids museum or something. Groove to the music from a live DJ. They're going to have hot chocolate, coffee. You can warm up with delicious food, including soup, pulled pork sandwiches, and cookies, and much more to come. How it works. The coldest night of the year is a peer-to-peer fundraiser. Here's how you can join the fun. Register as a team captain to lead your group. Invite friends, family, and co-workers to register and join your team to walk with you. Share your team page and encourage your networks to donate directly to your team. All funds raised go to the YWCA Jamestown Transitions Housing Program, which provides women and families in crisis with safe, supportive housing. You can learn more at cnoy.com/location/Jamestown. And we have one more announcement, and my throat's done.
We're going to give each other a break on the announcements. But what great opportunities today. Not only the Jamestown Winners Market, which is fantastic from what I understand, but the coldest night of the year a little bit later on today. So I'm going to be telling you about what's up on the screen right now. That's Bluey and Bingo. And I've heard of these two characters, but I don't have any experience with them because my family's grown at this point. But this is tomorrow on Sunday, February 23rd, from 1 to 5 o'clock. Oh, goodness. This says Killa Cookies. And actually, I just heard about Killa Cookies recently. And it says in parentheses, maybe it's an ice cream shop, but I was actually at the Winterfest with the Mayville Castle last weekend, and I met a couple people from this bakery, Killa Cookies, and I'd not heard of it before. Yeah, so they're located at 3423 Fluvanna Avenue Extended in Jamestown. And this is what's happening tomorrow with Bluey and Bingo. So it says to join us for a fun-filled day where your children and adults can meet their favorite characters from the beloved TV show Bluey. This exciting event offers a unique opportunity for kids to interact with Bluey and Bingo, those characters. You can create some unforgettable memories. It's a great day and a great opportunity on Sunday at Killa Cookies on Fluvanna Avenue in Jamestown. So you can meet and greet and enjoy that special time with these characters where children can take photos and engage with them, say hello and get the high fives and the hugs. And also there's a craft station there. The craft station will get creative and offer kids their own opportunity to have fun with Bluey-themed crafts to take home. Believe it or not, there's food there too, so there's snack time, which is great because the bakery and ice cream, you got to have something to eat there. Snack time, enjoy a tasty snack that will keep the energy high for all the fun activities they have planned. And they have a professional photographer there. So that photographer can capture the magic of the day with a professional photograph on site. These high quality photos will be available for purchase and can be emailed directly to you, so no waiting in the mail to have them come to you, ensuring that you have a beautiful keepsake memory of a great family afternoon for this special event. So don't miss out on this fantastic opportunity for children to connect with Bluey and Bingo while eating snacks and enjoying crafts and unforgettable memories. Sometimes those crafts look really good. So, you got to go in there.
Crayons and
So there is a website. It's www.headintotheparty.com. And Hedin is HEADENTOTHEPARTY.com. What a great event. And I understand this is kind of a new business. At least I was just hearing about this recently. So Killa Cookies, 2432 Fluvanna Avenue Extension in Jamestown on Sunday, tomorrow, February 23rd. It is a beautiful day here in Chautauqua. And we've got lots of things to do. That's always the best thing about coming on Chautauqua Sunrise. There are so many things to get involved with, and it's been kind of a yucky weather week, but now we've got some sunshine. I know here in Mayville we had blue skies, so I'm hoping they'll last the rest of the day. So you've got things to do and places to go and people to see and meet. So take advantage of it.
It feels so good not driving in the snow today to get up here. Just
Although
got the potholes now.
The potholes and the snow is piled up pretty darn high.
I took a picture out the window down the hall there of it.
I know Doc's got his dog, and he'll usually talk about his dog. We've got 2 dogs at our house, and our drifts are about 4.5, 5 feet high. So they climb to the top of the drift, and they look over the fence. The fence is about 4 feet high. So we're lucky that they haven't gone anywhere, which is nice. But they're really enjoying the drifts in the snow.
I mean, it's been a weird winter. You could get ice or salt for ice.
Yeah, that's a big topic
I
right
wanted
now.
a roof rake because the snow was building up. I got my roof rake yesterday.
You found one?
Not around here.
surprised.
It came from, I think, California and Amazon.
Really? Good old Amazon.
But I got a lot of it off, but underneath that snow is probably that much ice.
Yeah. What do they call that, an ice dam? When
Man, I don't know what it's called, but it's...
On the edge of the roof? Yep,
I
thank you.
waited for the roof to come crashing down on their porch, but...
The ice rake was a new concept to us, not being originally from New York State. And someone told us about an ice rake a couple years back, and we were able to get one. But you know what? That's hard work. Throwing that rake up there.
Justin and I took turns, but
Yeah.
I have one somewhere in my garage, but where? I used to live in a trailer, and you always had to clean the snow off that.
And that's harder. A friend of mine from where I grew up in Maryland, her grandmother was from Western New York, and she used to tell me stories about her grandmom getting out on the roof and shoveling off the roof. So I imagine a lot of people have that same experience
I've done it.
Yeah, you have to do it. You have to do
When
it.
you're
But
out
be
in Mayville
careful.
in the country with a trailer, you got snow.
But we got to be careful doing those things. But it's nice to have some sunshine for sure.
Oh,
So,
definitely. So we're going to have a PSA, and then we're going to get right into the show.
sounds good.
So, Jeff?
The color in my garden keeps the pink in my cheeks. I was very independent and thought I could take care of myself. I fell and I had to have Meals on Wheels. They're my savior. My name is Lola Silvestri. America, let's do lunch.
Drop off a hot meal and say hello. Volunteer by donating your lunch break at americaletsdolunch.org.
Awesome. My ma, she just loved Meals on Wheels. She got to hear her voice, you know, when she was home alone, and they'd bring her the food. So we're going to start out first with my co-host, Dana Corwin. Dana,
Good morning.
let's hear a little about you.
Well, you all have seen me here before for different things. The Walk to End Alzheimer's, different things with the Office for Aging. I am the director at the Chautauqua County Office for Aging Services, and I love that PSA because the home-delivered meals are so important for our older adults, not only for that friendly face and that kind of safety check when it's needed, but also just being able to live independent as much as possible in our community is so important for our older adults. You know, we've had a bad winter. We were just talking about, you know, the roof rakes and the snow rakes and the piles of snow. And when it's been really bad weather, there are times when we have to cancel the home delivered meal route, and that's a tough time for folks. And at the county, we try to keep everybody updated when that's really bad weather, and we also really want to encourage you to check on your neighbors. You know the people that live around you. If you don't, say hello, get to know each other, and just check on each other. Particularly when we have really icy conditions or snowy conditions, it's great to lend a hand, whether it's to sweep off a porch or shovel, or if you've got a plow, help to plow people out. I know there's been times in the county when I first moved here, and Maryland driving translated to New York driving took a little bit of time, and I went right off the icy road one day, and before I could even panic about it, a gentleman pulled over in front of me with a truck, jumped out, got a tow strap, and pulled me right out.
Wow.
Didn't
nice.
even take 5 minutes, and I was like, thank you so much. And that's what we really want in our community. We want everybody to be looking out for one another because it's a great community. Here in Mayville, we just had a wonderful winter festival with the Ice Castle, and I've been reading all kinds of accolades about the community coming together in the village and all the volunteers that put that together.
Weekend yet, too.
It is. I was just going to say, I drove by it yesterday. The Ice Castle's still up. The dragon is still got the red eyes, and you can get up close and personal with it. And it's amazing to see the construction of how it is put together. It's really interesting. So get out there and join us in the community
It
and
was
get out.
around 2004 or 5 that I helped build it for
You
2
helped
weeks.
build it, really.
Pulling all the ice out.
How
They
did-
have
It's like a
They
slide
have
or
a
something.
long thing out to the lake where they slide it through the water.
Yeah.
They would cut it every day, and I had to pick these chunks of ice up and throw them out of the way. But I'd push ice, slushing, all held together with snow and water.
Kind of packed in there,
Yeah. So if it rains,
Yeah, I got a chance to see it last weekend, and I went up and I kind of touched the wall of it just to see what it was like, because it's solid as ice. So, but happy to be here and happy to be co-hosting with you.
Oh.
And we did bring a visitor with us, a guest.
yes.
And so we'll finally tell you who's at the other end of the table. We have Sherri Rader with us, and Sherri is from the Chautauqua County Department of Health. And there's something special that the Department of Health is doing right now that we wanted to bring to your attention. And we wanted to bring you some more information because it really is an ask of the community for this special project that they work on. So, Sherri, welcome to Chautauqua Sunrise. How are you
Welcome.
doing this morning?
Well, thank you. Thanks so much for having me, Dana and Randy. So I'm Sherri Rader. I work for the Health Department. I am I manage the Administrative and Communications Division at the department. So what we do is kind of serve as an arm to the divisions there and do some of those administrative behind-the-scenes things, but then also the communications. So we're working on more of the public-facing where we're getting the word out about the programs, the services, the emerging issues. And so that might be like website, social media, press releases, coming here today and talking to you. So really fun thing about public health and working for the health department is that public health is a lot of things.
It is. It really is.
It's water, it's air, it's food, it's having access to physical activity, and a lot of other things too, but just to name a few. So as you can imagine, there's so many people and organizations, other organizations that are involved in the, making change in public health, positive changes. And so the fun thing, as I'm getting to with that, is that we get to work with a lot of other community-based organizations.
And that's exciting.
It's so exciting. It's fun. What's great is to see like the end result. So we'll work with committees, like I said, different organizations, and then we set goals, and you actually see positive changes in the health of Chautauqua County.
And that's wonderful, because we want to keep our community healthy in
Absolutely.
every way that we can. So there's a lot that all of us can get involved with. And before we kind of dive down that hole, tell us a little bit about yourself. I know I've come on the show before and said, I'm a transplant from Maryland, but I came here on vacation and fell in love with the county and the area. And my husband and I moved our family up here. We've been here about 18 years now, so we can't say we're new anymore, but I just can't say enough about the area that we live in. So tell us a little bit about yourself. Are you from Chautauqua?
Well, no, I am not. I've been in Chautauqua County, lived in Chautauqua County for about 25 years.
So you're not new anymore
I'm not new anymore either, but I grew up I didn't come quite as far to get to Chautauqua County. I was just over the border in Erie County, Pennsylvania.
Okay.
So very close to the border in a little town called Wattsburg.
I've heard of that.
Yep, grew up there in a rural community, and transitioned into Panama, and I live in the Sherman area now. But
very nice.
Chautauqua County, this whole area is just a great place to be. Having
agree.
the 4 seasons is kind of nice. I know that we might be a little grumbly now with getting to the end of winter. Some people love it. I mean, the snowmobiling's been amazing this year,
great.
honestly.
Yeah.
And our skiers are happy too. And then we get to experience the spring and the summer and the fall and the changing leaves, and a lot of areas don't have that.
Exactly.
So
and
that's
the
pretty cool.
beautiful areas of water that we have. It really is a fantastic place to live and work and play.
Yeah.
So, well, thank you for that information. I didn't know where you were from, so, it's always fun to say, where people are from and how they came here. And now let's talk a little bit about the work that you're doing. Because when I was thinking about what we could talk about today, I was thinking about like a topic that was happening that we could all get to know about and help to participate in. So we're talking today about the community assessment. I think we have a slide that we'll throw up there, because we first want a little bit of a extension on what the Department of Health Services are. So if we've got that piece up there, wow, who knew? Like you said, so you want to touch a little bit on all these things that make up our Department of Health.
Sure. So this is just a snapshot of some of the main things that we're doing at the health department. And so the one thing would be public health, and there's several different circles, areas there that you'll see that are related to that. So that's your maternal and child health that we are working on with we have our early intervention program. We have a welcome home baby program where we're visiting all the new moms in the county. We offer breastfeeding support. We offer immunizations. We prevent chronic disease prevention through our promotion of healthy living. And we have, in our environmental health world, food safety. So we're out inspecting the restaurants and making sure that the food and the conditions are safe for the people that are coming there. Water safety, just ensuring that our public water supplies are,
so important.
That's been a big thing in the county.
Absolutely. Yes, and we've heard about that in the news and different things like that. But also, even if you're buying a new home, then we do inspect that septic and the well, just to make sure that the product that you're getting is going to be safe for you,
Safe for
safe to
consumption.
drink. Yep. And so we work with the homeowners and the buyers and sellers in that aspect too.
I'll
There's-
jump in there
yeah.
and say, recently I just learned that the division that's environmental health also has been offering, and I don't know how many tests there are left, but radon tests that people can use in their homes.
Yes, thanks for bringing that up, Dana. So we do have a grant that has allowed us to purchase some radon kits. So the public, you can actually go on our website. It's healthychq.com. And there's a little button that you can press for radon, and then that'll take you to where you can actually get a free radon test kit. So there's our website on the screen there.
Excellent.
We'll get to the survey in a minute, but just to get back to the radon, so radon you cannot see, smell, or it's an invisible thing that's just could be there in your home. So it would be living typically in the basement of your home, or maybe sometimes even the first floor. And radon is the second leading cause of lung cancer, with, as you can imagine, smoking being the first.
Right.
And so people don't know. You wouldn't know that radon is in your home until you have the home tested. So we have these free test kits. You can go on our website. You can actually call if you don't have access to the internet. You can call us. Our
What number would that be?
Yes, 716-753-4312. We'll get you to the health department, and we'll be able to get that kit out to
Can you
you.
repeat that number again?
Yes, 716-753-4312.
Okay.
Okay.
Yeah, that's a great resource that we have in the county, and so many parts of our health that you all are looking after. So we're really appreciative of that. Water and housing and different things. What about, we always see, or at least I do, always see the advertisements for the rabies
Yes.
clinics.
So we do offer the free rabies, animal rabies immunization. So dogs, cats, and ferrets can come to the clinic with their parents, their owners. And we have a new clinic coming in at the Humane Society, which they've been really great to host several clinics for us. So this will be at the Humane Society in Jamestown, and that is on March 8th. So March 8th, you can go to our website, again, healthychq.com, and register. So you do need to pre-register for the event. And we are kind of running low on slots. So if you're interested, I just checked this morning, there's about 30 slots left.
So call.
Yeah.
If you've got
Yep.
a cat, dog, or a ferret.
A ferret too, yeah.
Are there a lot of ferrets in Chautauqua County?
I don't think so, but if you
wondered
own a
about that.
ferret, the ferret should be immunized for rabies.
And is
so.
there a cost for
It is,
that?
it is free.
Okay.
And
That's good to know.
all dogs and cats at least do need to be immunized for rabies. So that is a regulation that we have that the state
Right.
has mandated. So you
good.
would get a rabies immunization that's valid for 1 year, and then you can come back in the following year for the booster, which is valid for 3 years.
3 years, yes. Yep. I know that from our dogs.
Yeah.
So what a great
Phone call.
opportunity. We've got a phone call. All right. You're going to be in charge of this one.
Caller.
Good morning.
Good morning, Linda.
Good morning, Dana, and our guest, Sherri.
Sherri?
And our dear, wonderful, faithful person at Channel 5. Thank you very much, Randy. Dana, I wanted to tell you, I wanted to come to your presentation that you gave on Thursday to the Common Grounds Group in Chautauqua.
Yes.
I'm sorry I couldn't make it. I was looking forward to it.
Oh, well, I'm sorry I didn't get to see you either. It was a great conversation. It was very snowy that day. So I was actually
and
surprised.
Very frigid. Very, very
It was
frigid.
cold. We had about a dozen
and,
people.
Marie Duke organizes a lot of that. And I don't know if you remember Marie,
I
but
do.
she used to work in my office.
I do.
Years ago. And she even came on the cable show when she worked in my office.
Oh,
We
really?
did a
So
little
she was on the show.
presentation about our programs and employment. And
Nice.
she's just terrific. And she does so much around here. She's a lady that gets a lot accomplished, and so do you. And thank you for coming on. And I'm looking forward to hearing the rest of your show about the health department. I wanted to mention about ice skating. I love ice skating, and when I was in high school, I lived in the city on the side streets. We used to skate on the street.
Really?
Yeah, we did, on the streets.
So the ice had to be pretty thick, right?
It was thick and rough,
Oh.
and you had to be pretty good.
Yeah, especially no Zamboni, right?
Yeah,
to
yeah.
go through and clear.
And then we had indoor skating places too. That they were all, everybody would ice skate where I came from in South Buffalo.
Very nice. Well, you
when you
gotta
were
have
small-
strong ankles to rollers or to ice skate.
Yeah. When you were a small child, I remember I got my pair of ice skates. I think when I was 6 or 7.
Isn't that something? Well, that's a great memory too. Well, I'm
Yeah.
sorry I didn't get to see you in person, but I'm so thrilled that you called in today because it's a real pleasure to hear your voice.
Well, it's good to see everyone on. And I wanted to mention, too, and now that I don't work for anybody, I can get political, but I won't get too political. You were mentioning services and health services and Meals on Wheels in particularly. Everybody needs to contact their local representative, and especially our Republican representative, and it's Nick Langworthy, who is terrific. He sends me an update by email at least once or twice a week on what he's doing. And you need to contact him about keeping these services going, especially in the times that we're experiencing now with government cutbacks.
Great suggestion. It's always good to reach out to our elected officials and give them your perspective. You know, whatever that perspective is, you know, but
Well, I
certainly,
call him all the time. I call him yesterday morning.
yeah, and I've had interaction with his office as well, and they're always very easy to talk with and very obliging.
He's very personable.
Yes.
So I don't want to hold up your show. Thank you for coming on. I look forward to hearing more about it. Have a wonderful weekend, and I'm glad the ice castle is still up.
Me too. Me too.
It's going to be there till the 4th of July at least.
Hopefully not that long, but yes,
Okay, thanks so much.
it's a real treasure. So thank you, Linda, for calling in. It was great to hear her voice. We were hoping
Reed
that
Powers used to pick on, I think, Linda. Linda, did Reed pick on you about always moving the office of the agent down to the Lakeside Park?
Did you know? I don't think so. No.
Maybe it was Mary Ann, but
maybe
it
it
was
could
always
have
a
been.
bunch of cuts are going to move me down there. So I was down there one time. There's a big trailer there. So I cloned in office of the agent of Veteran Services for them.
Well, we're still doing our work, and that's wonderful. And we certainly miss Linda.
It's
She was a
great
big
work,
part.
and it's a service that's really
is.
needed,
It is.
especially around here with our high senior population.
Absolutely. So continue to be an advocate and get out there and talk to folks and let your opinions, you know, about the need for services be known.
Yes,
So,
yes. Well, I
thank
am an
you.
advocate, and I am a senior, and I have been for many, many years.
Check. You qualify.
Thank you.
You take care.
Bye-bye.
And thank you.
Thanks, Linda.
It's always great to hear her voice. But, you know, she's encouraging us to know the services in our community. And that's important because if we get into a situation where we don't know what the services are, then we get a little panicked, right? So we always tell people at the Office for Aging Services to plan ahead. You know, please look at these situations now and this information. And when we talk to folks, we always say, now you go tell everybody you know. So, because what we don't want people to do is be unprepared. And this is exactly what the Department of Health is trying to do in the community assessment, is really understand what's happening with health across all ages in every section of the county. And some of us had an opportunity to take the survey, you know, in preparation. You took it
I took it last night.
yesterday.
I mean, I'm going to talk about it. It's easy. Just fill in the blanks. I think there's maybe a couple places you can write comments. But at the end, they offer you to be in a drawing for a coupon for tax.
Yeah, little incentive. But let's start with Sherri about why do we do this thing called a community assessment? What's it all about?
Yes, so the community health survey that we were talking about is really very important because it's going to shape our community health assessment and also a community health improvement plan. So every so many years, all of the local health departments are charged with. It's a mandated service that
a
we need to
requirement.
provide through New York State Department of Health, which is something that needs to be done. So whether it was mandated or not, it needs to be.
Right.
It
We
does
need
need
to understand what's happening.
Yes.
Before we can plan to help.
Exactly. So
Makes sense.
that's a good explanation. And so the assessment, the community health assessment, is a collection of data. And so one of those data sources is the community health survey. So we know that people who live, work, and go to school, or because it can be one of those things, that's what your qualifying factor is to take the survey. You need to either live here or work here. So if you live outside of the county and
didn't
work
know
into
that.
the county, or if you go to school here. So we have a lot of college students that, some of them don't.
Exactly.
Well, they're living here perhaps
maybe not from
temporarily.
here.
But yeah, so we'd want their input as well. And so the folks that are taking the survey, you know a lot about the county, and you know a lot about yourselves, your family, your friends, your coworkers, the people that live here. So we want to hear about what you think we should be working on. It's all anonymous, but we have some sets of questions that are like multiple choice, and then, as you alluded to, Randy, there is some areas for putting in your own comments if you'd like. But so we feel like you all, the public, are a great resource, a wealth of information for us, and we take that very seriously. That data that we receive, and we compile it and then present it along with. So there's the survey. Another data source is New York State Department of Health has a data collection of tons and tons of just different health information,
Right.
and it's all
Statistics.
all
About us.
exactly, yeah.
I was looking at some of them, and they were quite interesting.
Yeah, so that's where we get a lot of our data, and we can actually compare how we are in a certain, let's say chronic disease. If we want to talk about cancer rates, or, for example, we can see how we're doing in Chautauqua County versus Erie County, or the Rochester area, and all of these, any other county
Any
within the
place
state,
in the
and
state.
then also statewide, so we can kind of see where we
And then I
fall
think
there.
even nationally. So all these questions about your health and your environment and go into this questionnaire. Can you tell us a little bit about the questions that we might encounter?
Yes, so I did, I've got a couple of questions here. These are a couple of the main questions. So this is one, which of the following community factors do you feel should be focused on to improve health in the next 5 years? And there's a list of various different things, like access to quality and health and wellness programs in schools, access to affordable, healthy food, reliable transportation, community spaces. Part of being healthy is being active, and so if you don't have access to community spaces, that might be a problem too. So just there's about 10 different choices there, and we ask you to pick a few that you think
in
are the
that
top.
question, it's really, what do you feel as the individual is most important?
Yes.
So you're really putting your thoughts and your perceptions into this assessment, and you're putting your stake into what we should be looking at.
Absolutely.
Which is important.
Absolutely.
I know, like food and transportation, for somebody like me, it's hard to think, I don't have any way to get to the doctor. I'm low on food, and what do I do? I mean,
Right. We've heard that term, food deserts.
Yeah.
Where, neighborhoods or cities or villages or towns don't have a lot of access to food, particularly fresh
foods, right. We're not talking, the local stores that might not have the produce, those are great and needed in the area,
definitely needed.
So definitely need, but, lacking just the access to produce, that seems to be,
Right.
I'm not trying to sway your answers in one way, but, that sometimes could be a problem.
And it's not the same for everybody in the North County or the South County or
really?
all the way on the east or the west or in the center. Everybody's living in a different space. So,
Right. So
it's really what's important to you.
Right. So we'll ask like your zip code, and so say if you were to answer a question a certain way, we'd be able to say, oh, okay, well this many people from this zip code are saying we'll get to the food access, that they have a problem accessing fresh, healthy foods. So why is that? And then we can look into that a little bit deeper. So another question that we have on there, which of the following disease and illness conditions do you feel we should focus on to improve health in the next 5 years? So not specific, I mean, you can take this specifically about yourself, or you can say, well, you know, I've got friends, family members, and of the options, several different ones here: diabetes, cancer, lead poisoning, mental health, obesity, lots of things. So we ask you to pick which ones you think are the top, you know, and so we'll take all that data along with, like I said, the state data, and then what we do with all the data
is the magic.
Yes, so we create an assessment, and it's available when it's finished. It'll be available for anybody to look at. It'll be on our website. But we have a community health planning team. So this is where I was alluding to before, the fun, you know, about working with the community partners to effectuate change is we're going to talk about all of that data and statistics with them and work with them to create a community health improvement plan based on the data and the resources available to us. You know, so bouncing all of these kind of ideas back and forth with those community partners. And Office for Aging Services is one of our community partners on the planning team.
We have partnered with you, and we are happy to do so because we represent and serve a certain segment of our population, including caregivers who may be younger. So it's really important. What I think is great is you can kind of give the information that's important to you. You combine that with the statistics from the state and the hospitals weigh in, and you pull all that information together, and then you start to plan out, because no one person, no one agency can do it all.
Absolutely.
Right? You really need to be able to have help from different agencies, like health and wellness classes, you know, smoking cessation classes, exercise classes. No one agency can do it all. So we work together to really put some things out there.
New York Connects hotline up there.
Yeah, New York Connects.
So what do they do for you?
New York Connects is what we call an Aging and Disability Resource Center. So we serve people from, I like to say, birth to you don't need us anymore. And we take calls and emails and walk-ins from people that are looking for services and programs and benefits around the county, whether they be kind of an older person looking for services, or someone needs help with their Medicaid or Medicare insurance situation. So we just are available for anybody in the county to call if they need help. So you're always welcome to call us, 716-753-4582. We don't have your community assessment link on our website, but I know you all have it on your website, correct?
Oh, sure.
So, and then if someone's not connected to the web or doesn't have internet, maybe they go to the library to get their emails, can they get a paper copy? Is it available in paper?
Oh, the survey? Absolutely, yes. So we have paper copies. You can also take the survey over the phone.
Oh, really?
If you needed that. So paper copies, if folks would want to help a neighbor out or a friend and print off a paper copy, you can do that. All of the information is at healthychq.com on our website. So you can take the survey online. You can download a printable copy. Our phone number, which I can also give that to you again to call in if you wanted us to mail you a paper copy, or if you wanted someone to actually talk you through the survey.
So that's the same phone number. The Department of Health. Go ahead and give it one more time if you can.
Sure, 716-753-4312. So 4312, and we can take care of that. It's also available in English, both English and Spanish.
Great.
So we've got that opportunity as well. It takes about 5 to 10 minutes to complete. So just 24 questions. It doesn't take that long. It is totally anonymous. We do have an option to enter to win one of 5 Tops $50 gift cards, so that is an incentive. And of course, if you're entering to win, we would need to collect your information, your contact information, so we can let you know that you won.
To send it.
However, just so you know, you take the survey, and then if you'd like to be entered to win, there's a link at the end to say, okay, click this link now and go to a totally separate platform to enter your contact.
Right.
And so it's totally, if anybody is worried about someone knowing who took the survey, we won't know. It's totally anonymous.
So safe information. So how long do we have to get this survey done?
March 31st. So we've got a little bit of time. Yeah. But
good solid month in a couple days,
yeah,
a week or so.
And so if you work somewhere where you might be able to post flyers about it to promote it, you can do that too. There's flyers on our website to download and print, or just for sharing at maybe a group that you're involved in, a church group or something like that.
Yeah, I was going to say there's great opportunities to share this with everybody. If you're in a civic organization, a club, a group, a church, a business, a book club.
Share it on your social media pages.
I was going to say on social media, when someone would go to Facebook, they could go to the Chautauqua County Department of Health, and there's information there as well that they can find.
Right, so if you go to our Facebook page, the community health survey is right front and center. You'll see it, and you can click on it to read about it yourself and find the links to go right to take the survey, and you can also share our posts. So that's a great way to get the word out as well.
So we've got till March 31st. We've got multiple languages available. We want to encourage everybody to take part of it because it really documents and puts forth your information about your concerns about health. So we know what it is, and then we know when all that information is compiled, it's all anonymous, which is great, and then you all take that, sorry, my voice is going, and then work with the plan and to put together a plan. And then how far out does this plan go?
Yes, it is. So this is a 6-year process. So right now we're in the assessment and planning year, and then the next 5 years we will actually be implementing the plan. So we won't offer this opportunity to get the surveys again for another 6 years. So
so
really,
limited time.
Yeah, limited time.
Offer. Do it now.
And there's lots of great things that come out of this assessment and plan. If we have time, I don't know if we do, I could tell you a little bit about that.
We've got our ticker right there.
Okay. Well, so last time around, we pick 3 to 4 different goals to work on. And one of the goals that we selected last year was to reduce deaths by drug overdose through the increase of access to Narcan or naloxone, which is a life-saving medicine that can be administered through the nose to someone who is experiencing a drug overdose to essentially reverse that effect to prevent someone from dying. So we increased our distribution of Narcan by 70% in the county. In 1 year alone, we distributed 7,000 free single-use Narcan boxes. And overdose deaths in 2024, this is amazing, are down by more than 50% from the 2023 stats.
That's wonderful.
Yeah, just an amazing, and now we can't say, well, that's solely because of the Narcan boxes, because there's a lot of great things going on in Chautauqua County in regards to substance use prevention. But we feel like we did play a role in that, with just getting those Narcan boxes out. So that was a great thing. But other goals that we focused on, things like programs for healthy moms and babies, programs to reduce smoking rates, healthy food options, safe medication disposal. Those are just a few things, but just to give you guys some idea of what we have done in the past. And you can go on our website, again, healthychq.com. You've probably remembered that now. I've said it so many times. And see, good. Like if you wanted to see some of the past assessments and improvement plans, they're all on our website. So you can check that out too.
Well, that's awesome.
Yeah.
Such important planning to help take care of not only the environment that we live in, but our health and things that will make us healthy.
Absolutely.
Moving forward. Some of the big things, dealing with a cancer diagnosis, smoking, hypertension and cardiovascular disease. Recently, February, I think it was February 7th, it was Red Day, where everybody wore red to kind of lift up information about women and cardiovascular health. So we're just very pleased and proud of the work that you all are doing at the Department of Health. We can't thank you enough. So we really want to encourage people to take a look at this community assessment. It's a limited time offer for you to participate, and the information that comes out of it will be very valuable in maintaining and improving the health of our community. So thank you for that, and thank you for being here with us today.
Absolutely.
Dana, we have 5 minutes left. I have
do.
a couple
It's going
things.
quick.
One we'll do real quick is Memory Cafe at the Reg. I was told about that. Doors open Jamestown by Len Berry.
Very good.
That sounds pretty good for.
Yeah.
So how does that work? I have dates.
Well, we've got a flyer, I think, up. If we can throw that up there.
There it is.
And this is a new offering in the county. And, on the screen you can see it's a memory cafe that is basically an opportunity within an organization to have a day for people to come at no charge for respite. And that's a little bit of a relief and a day away from the home or your regular programming at home, so to speak. So the Reg has put together a memory cafe, and we wanted to make sure people were aware of it because it's new. So you can see the one coming up, usually it's once a month. So we've missed February, but I understand that was a great opportunity for people to get out. And Bill Ward, I think we all know him, right? Bill Ward's going to be there on March 11th. And then there's music with Randy Graham on April 8th. And there's some registration information, and you can go online and just put in Memory Cafe at the Reg. But we wanted people to be aware of it because it's an opportunity for people to get out of their homes, caregivers and people alike that might have a memory impairment of some type, and get together with other people. So it's a great opportunity, and we're really thankful to the Reg Lene for getting that together and offering that to our community. So again, just a PSA about something new in our community.
So
and since we have 3 minutes left,
Chautauqua Expo,
yes, I'll take the last 3 minutes and just be greedy about it. We are so excited at the Office for Aging Services. Typically, we celebrate Older Americans Month, in May of every year. We celebrate older adults, and this year we are doing the first ever CHQ Aging Expo. And the reason we're doing this one-day expo is because over the last couple decades, our celebration has grown and grown, and we've served more and more people, older adults, for this one-day celebration. So we used to do a picnic at Midway, and we grew out of the pavilions. And then afterwards, we went with 2 different hotels kind of setups in the north and the south, and we served even more people. We couldn't fit everybody that wants to attend this great celebration. So this year, we are looking to have the event on May 22nd, and it's going to be the first ever expo, which means something a little different. It's just not a picnic. It is a great day to get together at the Williams Center at SUNY Fredonia campus, and we are going to be having a great ribbon cutting ceremony, and we're going to be having a big resource fair. I think we're up to about 80 different vendors of services and products and programs that people might benefit from. And then we have lunch. We can't sit down 1,000 people that we're hoping to have there, so we're going to have food trucks available for that day for lunch. And then most exciting is we're going to have small breakout sessions in the late morning and early afternoon, really guest experts on different topics that are important to older adults. And the last thing I'll say before we're getting right down to the wire on here is that we're not limiting it to older adults. We want people to be able to come and find out information about how to age well in the community. So we're inviting, adult children of people that are older, that they can come and find out what's available. Or maybe they're not, quite retired, but they want to know what's going to be available to them when they do hit retirement age. We want to open it up to providers and other folks that might have an interest in aging services. So we were really excited. We're just about ready to launch it, so you all have a little bit of the information ahead of time. So we want you to save the date, May 22nd. It'll be in SUNY Fredonia, and we're going to have a great opportunity for older adults and caregivers and providers to get together. And I think that it is amazing. You know how if you've been to a concert or a conference, you feel energized by being around people with the same mindset. I think our older adults in Chautauqua County should have the same experience. So we are hoping to have them all in, to have as many as we can join us on that day for fun and fellowship and learning about what's available to age well in our county.
Excellent.
Down to the wire.
Seconds. I just want to thank you, Dana. And
it's been a lot
Sherri,
of
fun. This was something different, and I'm glad I did it because I'm not having a lot of luck with my voice today either. So I want to thank Justin, Chris, and Jeff. Doc, we'll see you when you get back in a couple of weeks.
Absolutely.
And you guys have a great weekend.
Get out there and enjoy Chautauqua, okay?
Oh, yes. It's going to be nice. It's warming up a little, very little.